Hello, good day, good afternoon, and welcome back from the break. Welcome back to the 4th Digital Health Society Summit. We are now moving to the session block that will deal with the European health data space. And with me now is Annick Faes, who is the Chief Information Officer for Johnson & Johnson MedTech EMEA. Annick is responsible for managing the business technology team and for managing a portfolio of solutions and capabilities enabling the EMEA commercial businesses organization in MedTech. In this role, Annick plays a critical role in driving digital surgery strategy in EMEA with focus on data, wearables, sensors integration, and building ecosystems that can make a huge difference for patients and hospitals. J&J's current technology path is highly focused on data, intelligent automation, omnichannel experience, patient pathways, and will continue to drive innovative partnerships to achieve improved patient outcomes. And with this introduction, I would like to welcome Annick to give us a note called A Data Space to Unleash the Healthcare of Tomorrow. Annick, what are the opportunities there?
Thank you, and thank you for the very nice introduction. And I feel very privileged to be here with you all today. As already mentioned, my name is Annick Faes, and I am managing a portfolio of many different digital solutions and capabilities, and they all generate data. And at Johnson & Johnson, we recognize the power and the promise of data and the digital technologies in healthcare. After all, data has already revolutionized our entire value chain, ranging from development to clinical trials, production to monitoring, and it will continue to change the healthcare ecosystem to further accelerate change and increase the possibilities of what we can offer to patients and their families. Now, by unlocking the power of health data and artificial intelligence, we can reduce variability and predict outcomes. We can provide a broader access to healthcare knowledge and expertise across the globe. We can connect less favored populations to higher quality services and treatments, fostering precision medicine by personalizing care. It allows us to increase the connectivity between the patients, physicians, hospital and healthcare systems. And even more important, it empowers patients to have more control over their personal health. So therefore, we believe that we have a shared responsibilities to our patients, family members, and their loved ones to explore these possibilities and invest in a future where disease is a thing of the past. So let's reimagine the future of health today. In Johnson & Johnson, we are accelerating and expanding our digital capabilities to impact the care along the continuum. For example, in our digital ecosystem, we offer technologies at the inpatient stage that enable surgeons to take a first step into the future of surgery. One of our software solutions provides digitalized operation room procedural workflows and real-time analytics designed to reduce the variability in the OR by empowering the care teams to operate in a coordinated way that can deliver consistent, high-quality care in an efficient manner. But data can also improve patient empowerment and collaborative decision-making. Principles which we at J&J are already using to improve the patient outcomes and demonstrate the benefits of active participation in the digital transition. For example, we are offering a patient pathway capability and a support app, which aims to help patients better manage their health and keep track of their progress throughout the care continuum. In addition, sending medication reminders, it also helps monitor their activity and create reporting that can be shared with their healthcare provider for better monitoring of their developments. Now, thinking about all of these examples to succeed and to scale even further, we really need to address some of the challenges in the data ecosystem in Europe. After all, data science and the digitalization can only help advance healthcare if they are enabled by the right policies and the right infrastructure. So thinking about the challenges, first of all, our data is fragmented in different silos. We're using different different standards. And we have a lack of harmonized interpretation and implementation of legislations. So let me start with the data being fragmented into silos. By sharing some of the examples, we in J&J keep seeing the interoperability of healthcare systems and the wider health data as a major issue. Health data is not straightforward. It's made up in different languages, different systems and structures, many different sources ranging from electronic health records to smart devices like an Apple Watch. And in addition, different countries have different ways of collecting and classifying the data across the care settings. Yet, data science really depends on the availability, but also the sufficient volume of high quality data. Therefore, a call for the health data ecosystem to be connected based on federated networks of fair data, which will benefit us all. We call for public investment in healthcare data infrastructure and connectivity that ensures that no patient is left behind in order to overcome the digital divide. And we also call for the adoption of common standards for all health-related data, such as clinical data, to overcome the data fragmentation, ensuring that the data is of sufficient quality to be shared and to generate insights. Now, thinking of the lack of harmonization in the interpretation, it is a known issue that despite the GDPR objective to increase the harmonization, member states have taken a different interpretation and adopted different diverging rules on secondary use of data, creating a patchwork of access rights and obligations throughout the EU. Multiple and sometimes conflicting local policy restrictions on how healthcare data can be used, they hold us back from truly realizing the full potential of turning real-world data into real-world evidence that really can have physicians, payers, and also policymakers that they can use the best decisions for the patients. So we call for a very clear harmonized rules on permitted data access, sharing, and use that provide a legal, predictable framework where stakeholders are involved through public consultation. And I think it's especially now really timely, as several new EU initiatives on data policy are going through the legislative process. European Health Data Space, the Data Act, the Artificial Intelligence Act, and previously the Data Governance. The interplay between these and the implementation at the member state level must be clear. But the good news is that I believe that we here in Europe are uniquely positioned, as we have the institutions to be able to collectively address these issues, so that we create the opportunities to drive innovation while respecting patient privacy and the ethical concerns around big data and artificial intelligence. So how can we address this? I believe that this is why J&J truly welcomes the European Health Data Space proposal and its aim to create an ambitious and cohesive European data ecosystem that truly unlocks the power of data, based on the full respect of ethics, privacy, and security principles. By doing so, it will help unleash a much needed change in the patient paradigm, really moving from the old, very disconnected, reactive patient paradigm into the new patient paradigm, where it's about personal treatment, where it's about connecting, being connected patients. And it's really moving from a reactive into preventative. Now, we believe that a European health data space based on the federated data networks of fair data could really help tear the silos down, encouraging public investments in healthcare data and the adoption of common standards that allow for previously segregated information to become connected, and therefore really critical for new clinical insights and R&D opportunities to be developed. It is also essential that the European health data space provides legal clarity and a framework for more consistent rules on accessing the data to develop the harmonized interpretation and implementation across the different member states. It empowers citizens, patients, and healthcare professionals for the delivery of healthcare and truly fostering healthcare innovation by ensuring stakeholders have access to all the right data types for the right purposes. By the success of the European health, but the success of the European health data space, it's not just down to policymakers. It is a true team effort involving all of the relevant key stakeholders. The industry for one, and J&J specifically, we can share our extensive experience in learnings and developing health data networks and using them to develop better outcomes for patients. But we can't do this by ourselves. We are only a single company, one player. But we really need a whole ecosystem of companies to shape the digital future of health and keep Europe as a global leader. This is why we as J&J truly believe and support fostering partnerships that move away from the silos and the individual solutions towards a more holistic vision of data management and standardization. For example, very recently we announced a strategic partnership with Microsoft to further expand our digital surgery ecosystem. By combining the vast unique expertise of both our companies, Microsoft's cloud with Johnson & Johnson's next generation robotics, world-class instrumentation, advanced imaging and visualization, we hope to drive innovation that advances skills, improves workflows, and enhances surgical decisions to ultimately improve patient outcomes. On the policy side, J&J is one of the sponsors of a coalition run by Digital Health Society and the European Institute for Innovation through Health Data. I believe that there was a session also before today on this one. Since it was started in 2019, they organized 6 roundtables, discussions aiming to provide multi-stakeholder recommendations on health data governance. These have been so well received and taken up precisely because they were developed by an engaging and a wide range of stakeholder perspectives. And I believe there will be a link shared with all of you in the chat. And lastly, Johnson & Johnson is also one of the founding members of All Policies for a Healthy Europe Coalition, an intersectoral initiatives that bring together a diverse group of actors, ranging from NGOs to think tanks to companies to advocate for citizens' well-being, being placed at the center of the EU policies. But above all, for the European health data space to be successful, we have to have trust. We have to build our ecosystem based on trust, as the nature of health data is extremely sensitive and really needs to be adequately protected. We must respect the sensitivity of the information that we handle and providing a secure digital environment where we can operate effectively and efficiently with human touch at every point. It should involve the 4 different elements. First of all, it has to be demonstrating the benefits for all health communities, ranging from patients from HCPs to policymakers. Communicating the risks of not using database technologies in healthcare when it has been proven to increase efficiency, reduce costs and errors, and generally making it easier for patients to receive the healthcare that they need. Secondly, patient-centric services, with a focus on improving digital literacy via policies supporting capacity building across the healthcare ecosystem, including the upskilling of the current and the future healthcare workforce. Third, data protection and security by design. The technology needed to achieve this and minimize the risk is there. The European health data space represents the perfect opportunity to develop them at a wider scale with a common approach and a compatible governance model. And finally, leveraging on existing successes. There are so many success stories out there of public-private projects, collaboration between technology and healthcare industries, which should be built on and used for guidance. They have the resources, the capabilities, and the global reach to maximize the society and the individual benefit of increased data access and use with clear proven standards. So in conclusion, people centricity, inclusiveness, partnership, innovation are fundamental principles that will enable this trust and therefore set the European health data space up for success, empowering researchers in developing new healthcare solutions, doctors and nurses to be enhanced in medical practice, and patients to control their own data and their own health. I believe that we must fulfill this vision in order to unleash the promise of digital and achieve the healthcare of tomorrow, truly delivering a new generation of care for the benefits of the patients and the society as a whole. And I want to thank you all, and I really hope that you have a great rest of the event. Thank you. Bye.
Thank you, Annick, for sharing with us this very positive message and finishing with some positive future or positive vision of the future. For all of us who are watching us, the roundtables reports can be found on the website of the Digital Health Society. Digital Health Society. So we invite you to visit the website and also follow the Digital Health Society on social media. Thank you again, Annick, for this keynote and this introduction to the next session that will follow after a short break. And this will be moderated by Julian Venn, the director at the Digital Health Society. And the topic is how to make European health data space a success, perspective from stakeholders. So stay with us and see you shortly.